Hey, good evening, everyone. Welcome to this evening's webinar on COVID-19, loneliness and isolation, fatigue, self-care strategies. I'd like to thank you for taking the time to participate in this evening's webinar and to take the time to attend. My name is Catherine Sisak, and I'm a clinical manager with Disability Prevention Services at Homewood Health, where I oversee our national trauma care and depression care programs. I also provide clinical support on the treatment side following substance abuse expert evaluations and fitness to work assessments. So it's my privilege to be with you all this evening. Homewood Health is Canada's leader in mental health and addiction services, and we provide a continuum of stay at work, return to work, and treatment services through our team of over 4,500 staff and clinical professionals. Our complete suite of services includes organizational wellness, employee and family assistance programs, assessments, outpatient and inpatient treatment, recovery management, return to work, and family support services. And these are all customized to meet the unique needs of individuals and organizations. A full list of our services can be found online at www.homewoodhealth.com. So in terms of what we'll be covering in this evening's session, we'll be looking at COVID-19 and the psychological impacts of loneliness and isolation, the importance of self-care during the COVID-19 pandemic, making self-care a priority and what the foundations of self-care are, and then finally, some practical applications. So hopefully walking away from this evening's webinar with some useful, practical self-care tools and strategies that you can start to use right away, right after the webinar. We are a fairly large group. We've got about 120 people on this evening's webinar, which is fantastic. If you have any questions or comments, I would just ask that you use the Q&A, the chat, like the typed chat option, and I'll stop every so often during the webinar to take a look if there's questions and answer them. And I'll make sure that we've got some time at the end to answer any questions or comments as they come in. The goal for this evening is to really spend some time reflecting on your own mental health and where you are at this time, 1 year into the pandemic, and to really be able to increase your own awareness and understanding of the psychological impacts of isolation and loneliness, to enhance your knowledge of the factors that can actually support health and well-being during the COVID-19 pandemic, to learn creative ways to create connections and nurture relationships during the pandemic, and then finally to gain tools and strategies for the development of a successful practice of daily self-care. So if we start just by looking at COVID-19 and mental health, and just starting with some statistics. So people who define their anxiety as moderate to severe, that number actually jumped to around 20%, which was a quadrupling of pre-pandemic rates. So we can see that the impact of the pandemic has had a really significant impact on the number of people who are reporting experiencing moderate to severe anxiety. About 4% of people said they experienced severe depression before the pandemic, and as COVID unfolded, that number doubled to around 10 to 13%, so quite striking. In terms of substance use, about 25% of people reported binge drinking, and of those who previously consumed cannabis, 34% of people said that they increased their consumption during the pandemic. And finally, 2.5% of the population reported having suicidal thoughts in pre-pandemic 2019. And in a May survey, 6.4% of people responded to having experienced some type of suicidal thoughts, and that further increased to 10% in October. So, I think some pretty important statistics, just highlighting the impact of being 1 year into the pandemic and what impact this has having on mental health collectively. Added to that, mental health in the workplace certainly affects all of us, all of our well-being, and now more than ever, it's really taking an immense place in our lives and reflects in our workplaces. aside from our home and personal life, the workplace is truly the primary location of adult life, and it really plays a hugely influential role in an individual's health and well-being. And, as the statistics that we looked at, those statistics really show that mental health concerns are significant. And unfortunately, they have worsened in the past year for Canadians due to the pandemic. And so the role of people in the workplace, of HR, of leaders, of managers, of occupational health and wellness teams, it's really critical in terms of being able to support the mental health of employees, of teams, of leaders, and working to change this. And so what I would encourage you to do as we go through this evening's webinar is to also take some time to reflect on your own mental health, to consider any changes that you've noticed in yourself as you've been working and living and surviving in a pandemic world for the last year. In terms of loneliness and isolation, loneliness occurs when a person views themselves or has this experience as being socially isolated. And that can be true even if that person is around other people. The toll on people's mental health during this pandemic can be further impacted and exacerbated by the experience of loneliness and isolation. And truly, concerns about isolation and loneliness have only increased since the pandemic began. During a recent mental health pulse check, Canadians were asked to rate their level of concern regarding isolation and loneliness on a scale of 1 to 10, where 10 represented the highest or the most significant concern. Before COVID-19, the average level of concern was 2 on 10, and that increased to 4.1 on 10. So it was an average score that increased by 21%. So we can see that collectively really impacted by loneliness and isolation, and there's a growing concern about what's the impact of this cumulative impact of loneliness and isolation on ourselves, on our children, on our communities, and what toll that's taking on mental health. And so, the concern about loneliness and isolation makes sense in the sense that as a collective, we're all experiencing loneliness and isolation to some degree in various ways and for various periods of time. For some who may be living alone, others may be far from close friends or family. Even if you do happen to be living close to family and friends, there's all of the different restrictions and bubble limitations and requirements, physical distancing rules and guidelines, and so forth. It's becoming more and more common that many of us may have been required to quarantine because you either contacted the virus or came into close proximity with someone who tested positive. In our professional lives, you may be still going into the work site, but certainly the work environment has changed in terms of how close you're perhaps allowed to be to your colleagues, what's permitted in terms of break time and lunch hours and so forth. Or if you're working from home, isolated from colleagues and interactions really being mainly by phone or video. And so we can see how without meaningful or in-person social connections, we can start to feel lonely and isolated. And being disconnected from our communities, and those communities might be our school communities if our kids aren't going to school, being disconnected from faith communities, from hobbies and recreational activities, the gym, neighborhood socializing, and also being isolated and lonely in terms of how the pandemic has impacted our ability to commemorate important milestones in life. So if you think about how weddings, death and funerals, the birth of a new baby, how that's all been impacted in terms of how people have not been able to commemorate, honor, celebrate, and support around those really important life's milestones. So taking a look here at this wellness wheel. So this wellness wheel notes 6 dimensions of wellness that we'll review together. And those 6 dimensions are spiritual, physical, nutritional, psychological and emotional, intellectual, social, and community. And so what I would encourage you to do is just to reflect on each of these areas, and I'll review them briefly, and to consider in which areas you are functioning actually quite well and you feel that you're kind of doing well overall, and then in which areas you might be having some difficulty. And as such, some of the self-care strategies that we'll talk about can be applied to further develop and grow and strengthen any areas where you feel that you might be having some difficulty. Okay, so the physical dimension really applies to wellness habits that have an impact on our physical being. So we're talking about things like sleep, exercise, and in the past 12 months, a lot of people are reporting feeling exhausted, even though they may have had a good night's sleep, and not understanding why, just feeling really fatigued and blah and lethargic. People are reporting physical symptoms like headaches and migraines, muscle aches and pains, and then also flare-ups of any chronic conditions like asthma or any other chronic medical issues, right? The nutritional aspect, so this refers to eating nutritiously and consciously, making sure you eat a variety of fresh vegetables and fruit each day, limiting intake of sugars, processed foods, salt and caffeine. So these are some of the areas within that dimension. And so in the last 12 months living in a pandemic world, you know, a lot of people are reporting having difficulty, having trouble making nutritious decisions when it comes time to meal or snack time, or knowing what the nutritious decision is, but are really lacking motivation in this area, wanting to go with what's easiest, what's the most convenient. So you might be noticing that you may have been eating more, may have been eating less, consuming drugs or alcohol more. And so these are sort of some of the things to be aware of in that nutritional aspect. In the psychological and emotional dimension, so this really goes to, you know, personal emotions and being aware of what your emotions are, the ability to maintain a relatively even emotional state, and also noticing what your feelings of hopefulness are or are not, any feelings of discouragement, feelings of irritation, what the impact of restrictions are having on your mood, and so forth. Okay. The intellectual dimension is about the ability to think clearly, independently, and critically. It includes things like reasoning skills, being open to new ideas, being able to think clearly, and being able to recollect with little impediment from emotional baggage. And so, you know, people are reporting having difficulty with focusing, with concentrating, feeling foggy, feeling absent-minded, feeling forgetful, and so forth, losing a sense of time as well. The social aspect, so this points to the caring connections that we make with others, our relationships, our day-to-day interactions with others, the connections that we have. And this can include things like group memberships, sharing friendships, being open and accepting another person's care, practicing empathy with those around us. And so certainly with all of the restrictions that we're facing, feelings of loneliness are, you know, very common. Missing this connection with other people, connection beyond the screen, and just wanting to again reconnect with the world out there, feeling frustrated about how others may be acting during the times of the pandemic, or wanting to withdraw from others, right? So just noticing how functioning is impacted in terms of social and community. And then finally, the spiritual dimension is really about purpose and meaning, and this has certainly been impacted for many people in terms of coping with the pandemic. So this is really the sense of where do I fit in? Why do I matter? What's the purpose? And so forth. And so these areas might not be clear, but a person, you know, should be aware of their importance and always be striving to seek clarity of your own personal values. And so in terms of that spiritual dimension, for many people, a common feeling has been really a lack of direction, feeling stuck, feeling unmotivated, and existential type questions coming up of what's the point? Does this matter? And so forth. And so again, would invite you to just spend a moment to look at these 6 dimensions and consider for yourself where you're functioning pretty good, and then what might be some areas where you might want to consider some self-care strategies to be able to improve functioning and strengthen some of those areas. In terms of, why we might be having difficulty in some of those 6 areas of functioning that we looked at previously, loneliness and isolation may actually be one of the main contributing factors behind the negative effects on various dimensions of your wellness. So if you feel low in some of those areas that we just looked at, it could be that loneliness and isolation related to the pandemic is a significant factor in terms of why you're functioning may be impacted negatively in some of those areas. So what can we do about that, right? Loneliness and isolation fatigue is prevalent during COVID-19 because some of the physical distancing and the isolation rules that we've all been dealing with for the last year. There's also the impact of changing restrictions. School is open, school is closed, restaurants and stores are open and closed, and daycares. So that takes a toll as well, the back and forth, and just this unknown of, can we count on being able to see family members and getting together outdoors or indoors for holidays? Can we count on being able to send our kids to school, etc.? So we can obviously understand this experience of being just COVID tired and COVID fatigued, and just recognizing that we are not alone in these feelings, and it's really expected and understandable given the situation that we're all in. It's taxing and exhausting maintaining vigilance and following pandemic rules and guidelines, and perhaps enforcing others to follow those guidelines as well, depending on your personal responsibility or your professional responsibilities, making sure that others are following certain guidelines as well. And so, as human beings, we're really wired to be connected to others as a matter of survival, right? To be attached and connected, to tend to our relationships. Really, as a collective, we are meant to be interdependent on one another. And so just like thirst signals our need to drink water, and hunger signals our need to eat, loneliness and that experience of being isolated is a signal to us that we really need social connection. And that instinctive need within us to socialize and connect was born out of survival needs dating back to prehistoric times, where our species was required to depend on and cooperate with each other in order to survive cruel and brutal environmental circumstances. And so as a collective, we have come to expect access to social relationships, to community, to togetherness, to support, and we truly require socialization and connection in order to be mentally and physically fit. So in addition to the psychological impacts of loneliness and isolation in terms of our mental health, there's also numerous significant physical health impacts of loneliness and isolation. So studies have shown that a lack of human connection can actually be more harmful to your health than obesity, smoking, and high blood pressure. Pretty striking. Long-term physical health risks associated with social isolation and loneliness increase mortality risk by up to 30%. And so when we're feeling lonely or isolated, it's very difficult, or we feel unable, or we may be unable to take steps that would help relieve stress. And many of us don't even have access to our regular stress reducing or stress releasing activities like our social lives, different communities that we may belong to, different groups that we may belong to, in-person connection, all those things that help us feel well and supported and connected, we're not able to access that. And so viewed in this way, it really does make sense that loneliness and isolation results in high levels of stress. The encouraging news, or the good news, is that the part of our brain that controls our stress response, which is the limbic system, also controls our relaxation response. And so this is why it's really important to use skills and strategies that can trigger the relaxation response in times of loneliness and isolation, so that we can actually physiologically decrease the levels of stress that we're experiencing and enhance our health and limit negative impacts of stress. So I'll present a couple of relaxation type exercises in this webinar, and you can consider, you may be using some of them, you may consider trying some of them. And the key thing to note is that when we relax, instead of cortisol, our bodies actually generate endorphins, dopamine, serotonin, and other endogenous chemicals that enable us to feel good and become healthier and stronger physically and mentally. So relaxation in terms of combating the stress of loneliness and isolation, this is one of many aspects. It's one of many self-care tools, but it's certainly an important one to consider trying. And so there is hope. There's many things. Relaxation is one of the things that we can do to combat loneliness and isolation. And there's lots of other strategies as well that I'll cover. And things that we can do, some of them are a bit out of the box and creative, require some flexibility on our part and open-mindedness, but different things that we can try to put into place to allow us to feel some sense of connection and community when we are so isolated, when we may be experiencing really significant loneliness, and that still allows us to respect physical distancing guidelines. And so turning to self-care, and what do we mean by self-care? So self-care refers to activities and practices that we can engage in on a regular basis to maintain and enhance our health and well-being and decrease our levels of stress. So it's really taking care of self. And that's going to look different for every person depending on their nature, their temperament, if they're introverted or extroverted, what their interests are. You know, for some people, self-care might be, you know, finishing a project that they've been working on in the shed, in the garage. For other people, it might be doing something, you know, taking care of themselves, going for a walk, exercising. For some people, it might be dealing with things that they've been putting off, doing your taxes, tending to your own medical appointments. So self-care can really look very, very different from person to person, but it's about taking care of the self, doing small and meaningful things that replenish your energy to be able to keep going. Okay, so it's really about making choices that will enhance our health and well-being and increase our resilience in the face of loneliness and isolation. I think it's important to remind ourselves that the choices that we make around self-care don't have to be these kind of grand gestures of self-care. They can be small but meaningful actions that, if taken regularly, can have a lasting positive impact. And so the importance of self-care during COVID-19 is just, you know, so I think obvious, given the toll that the pandemic has had on all of us. And the idea with self-care is much like your healthcare provider would take your vitals if you would go into for an appointment. The idea really here is to take your own vitals throughout the day. You want to be checking in with yourself and assessing your own health and well-being really throughout the day, right? So this is one of those self-care strategies, increasing your self-awareness, checking in with yourself. How am I doing? And getting really specific, right? So checking in to see, how am I doing physically? Am I feeling tense? Am I tired? Am I thirsty? Am I hungry? Do I need to sit down? Do I need to stand up? How am I doing mentally? Taking those types of vitals, right? Is my mind racing? Are my thoughts pretty calm? Am I focused or unfocused? Checking your emotional vitals. So how am I feeling? Am I anxious? Am I calm? Am I uncertain? Am I bored? Am I grateful? And socially, right? How are my vitals doing in terms of that social aspect? Am I feeling connected? Am I feeling isolated? Am I feeling lonely? Okay, so just really paying attention to how you might be doing. And so the idea is really to make self-care a priority and to do it proactively and preventatively. So, you know, you can find the best mechanic to fix your vehicle each time it breaks down, but your mechanic can't prevent the impacts of wear and tear or over-abuse or abuse of your vehicle that might lead to the next problem. And so much of the effort and expense could be saved by practicing preventative self-maintenance and taking greater care in how you operate your vehicle. Really, it's the mechanic and the driver in collaboration who are necessary for ensuring efficiency, dependability, and longevity of the vehicle. But it's really the responsibility of the driver, of us, for prevention. And so the same is true for our health and well-being, especially during times of loneliness and or isolation. You know, during COVID-19, during this pandemic, there's so much that's uncertain, and there truly is so much that's out of our control. But I think the self-care piece and making it a priority, this is one of those aspects of, you know, what's the role that we play, and accepting ownership of the role. What do we have control over? What am I able to do in terms of supporting myself and in terms of being able to do some self-care so that I can really keep going? Okay. So the foundations of self-care are practicing healthy thinking, nurturing your body, supporting your spirit, building a strong support network, looking at creative ways to nurture self, and also creative ways to nurture relationships during the pandemic. And so we'll look at these a little bit more closely together. And so as we're going through these, I would encourage you to just pause and consider if there's any of these strategies that you're already using or that you'd like to put into practice. Just before I turn to these, I can see that there's a couple questions that have come in, so I'll just take a look at the chat. Oh, I guess not. Okay. So in terms of practicing healthy thinking, you know, some of the thoughts that that I've heard from those around me. I work from home. I should be able to make supper every day. My kid's only in elementary school, but I'm just not able to manage virtual learning. I'm not good enough. I've gone long periods of time before without seeing my family, without seeing my grandchildren before. I should not be finding this so difficult. I'm not traveling for work. My spouse isn't traveling for work. We've got all this extra time. Why are we so disorganized, and why can't we make more progress on the to-do list at home? And so this tool, this self-care tool, this mental health strategy of practicing healthy thinking, it's really paying attention to, you know, some of those examples of the thoughts that I shared. And for anybody who's participating and is a fan of Brené Brown, she talks about the stories that we tell ourselves, right? So practicing healthy thinking, the first step is really just to be aware of, okay, what's the story that I'm telling myself? What is my interpretation? What's my perception? What's the tape that's playing in my head about how I'm coping, how my family's coping, about the situation, etc., about expectations I have for myself. And you know, number one here is creating distance from the thoughts, right? So you might actually visualize, this is a really good strategy, a stop sign. And when you notice yourself ruminating or being in kind of one of these rabbit holes and your mind is spinning, to practice visualizing a red stop sign, like stop, right? And to describe, this is part of it as well. So to describe, and you might do this in your head, you might write it down. Okay, what are my thoughts and what am I telling myself? What are my emotions, right? So if you say to yourself, I work from home, I should be able to make supper every day. So what are the emotions linked to that? How do you feel about that, right? And what are your behaviors? How are you reacting? And what are you doing to cope, okay? Being curious about your thoughts and treating our thoughts as information, but not as facts, okay? So, you know, I've gone long periods of time without seeing my family or my grandchildren. I should not be finding this so hard, okay? So that's not actually a fact that you shouldn't be finding this so hard. It's information that you're having this thought, but you are finding this hard. You are finding this difficult, right? So just being curious and treating your thoughts as information, being almost like a detective in terms of noticing what your thoughts are and being able to describe them non-judgmentally. And then self-compassion. So treating self with kindness instead of judgment, right? Common humanity versus isolation, right? So reminding yourself that you're not the only one finding it difficult. Anybody who's got kids at home and is trying to homeschool and work is finding this difficult. Anyone who's got aging parents or family who's immunocompromised and is finding it difficult figuring out how to care for them and support them while working and all of that, would find it difficult. Anyone who's living alone and is just feeling so isolated would find that difficult. So that the common experience, most people would find this difficult. And then being mindful of what your experience is, how difficult it might be, but without over-identifying or dwelling on it, right? The practice of self-compassion, Kristen Neff, N-E-F-F, she is really one of the world's leading researchers on self-compassion. If this is a practice, a tool that interests you, I would encourage you to go onto her website. I believe it's selfcompassion.org. She's got lots of short exercises. Some are as short as, I think, 4 or 5 minutes long, where she can, it's a guided exercise on practicing self-compassion. So looking at nurturing your body, so being physically active. So we know that physical activity is beneficial for bodies, for our minds. Studies have shown that regular exercise can increase our levels of happiness and reduce feelings of stress and anxiety. We want to make sure that we're doing what we can to get a good amount of sleep per night. Also want to make sure in terms of sleep that we're getting at least 7 hours of sleep a night. So very, very few people can manage with less than 5.5 hours of sleep per night. Trying to keep a regular sort of bedtime for everybody in the house, that balance between being flexible, but also still keeping some type of a predictable routine. The benefits of keeping our sleep in check and keeping our sleep hygiene a priority is that when we're rested, it keeps our emotions in check. We're able to manage our stress better, and it just allows us to be feeling fresher, more sharp-minded, just more able to manage the day-to-day challenges. Okay. And then finally, healthy eating. So just becoming aware of eating and shopping habits, trying to reduce caffeine and sugar intake and decreasing the intake of processed goods, drinking water, and eating food that increases your energy. And then supporting your spirit, right? So certainly our spirits have been impacted by the pandemic. And so different self-care and mental health strategies that you may already be practicing or that you can consider giving a try. So the practice of mindfulness is really about paying attention in a particular way, on purpose in the present moment and non-judgmentally. And so mindfulness practice improves the immune system and alters activation symmetries in the prefrontal cortex. And this is a change that's previously been associated with an increase in positive affect and a faster recovery from negative experience. So engaging in a regular mindfulness practice allows us to focus our thoughts and develop greater awareness of our feelings, increase our positive emotions. So if this is something that's of interest to you, I would encourage you to, there's many, many resources. John Kabat-Zinn is certainly one of the leaders in this area. Lots of really good exercises available online in terms of mindfulness. Gratitude is the practice often used by those who have a strong and resilient mindset. It has been shown to have a positive effect on those suffering from PTSD. And in fact, a study done on Vietnam War vets who had suffered from PTSD showed that daily gratitude had positive effects, demonstrating positive relations and supporting overall well-being. And so in times of loneliness or isolation, we might focus our gratitude on the fact that we're healthy, we have access to health services, to technology that connects us with family and friends, we have shelter in order to isolate safely and warmly, etc. Okay, and gratitude also can be shared. So just expressing to someone that you appreciate, the conversation that you had, you appreciate them checking in on you, sending just that simple text of thanks. It mattered to me what you did. Makes you feel good, makes that other person feel good too. And then a number of exercises that you can use to support your spirit. And so one of them being mindful breathing. And so in this exercise, it's really simple but significant. The power of the result can be really very great. So the exercise here is really to just simply identify your in-breath or your inhale as your inhale as your in-breath and the out-breath as your out-breath. And when you're breathing out, you're mindful that this is your out-breath. So in this exercise, the object of your mindfulness is your breath, and you're just focusing your attention on it. Other mindful activities could include mindful eating, right? So really using your five senses, noticing what does your food look like, what does your food smell like, what does it feel like, and so forth. Mindful walking, right? Again, using your five senses to take it all in. Mindful toothbrushing could be really anything. Mindful dishwashing, but using your five senses to really center yourself in what you're doing and on that present moment, noticing your breathing. As you're doing those exercises, it's quite likely you're going to find your mind wandering and you're going to be out of that present moment. That's to be expected. It's just to notice when that's happened and to gently bring yourself back. Okay. The second exercise is that while you breathe in, you follow your in-breath from the beginning to the end. And if your in-breath lasts 3 or 4 seconds, then your mindfulness also lasts 3 or 4 seconds. So this exercise is really about concentration. So breathing in, I follow my in-breath all the way through, and breathing out, I follow my out-breath all the way through. From the beginning of my out-breath to the end of my out-breath, my mind is always with it. And so the mindfulness becomes uninterrupted and the quality of your concentration is improved. Releasing tension or progressive muscle relaxation is an excellent self-care and mental health strategy to use. It's also very helpful if you have difficulty falling asleep or staying asleep. And it's really a practice of learning how to breathe and also tense and release the tension of muscle group by muscle group, starting from your head to your toes or your toes to your head. If you look up progressive muscle relaxation online, PMR, you'll find a number of excellent guided progressive muscle relaxation exercises. And so the idea here is that when you're truly aware of your body, you'll notice some tension and pain in your body and some stress. And the tension and pain has accumulated for a long time and our bodies suffer, but our mind is actually not there necessarily to help release it. So the practice of releasing tension is actually physically learning how to tense and release different muscle groups, right? So while you're driving your car, you might notice the tension in your body. You're eager to arrive. You don't enjoy the time you spend driving. When you get to the red light, you just want the red light to flip over to green so that you can continue. But that red light can actually be a signal, right? It can be a reminder that there's tension in you, that you're stressed, of wanting to arrive as quickly as possible. And if you recognize that, you can make use of the next red light. You can sit back, you can consciously try to relax your mind, your body, and then take the 10 seconds of that red light to practice. Journaling, so writing down things for which you are grateful, small and large. And journaling, I mean, you might have a journal or you might have Post-its or you might have an old receipt, but it's really just that habit of writing down something you're grateful for, or, you know, sometimes families or couples or friends will exchange sort of one thing with each other that went well that they were grateful for at the end of the day. It can be really effective. And a gratitude letter, right? So again, expressing our gratitude to those around us. And so relationships, connection, community. So we know, as we discussed, that social support is a healthy and adaptive way to manage stressful events and also to hear outside perspectives, to get some feedback, really, really meaningful. You want to try to check in with your friends and families and neighbors, coworkers regularly, using technology to stay in touch as best as you can. And then, you know, just bearing in mind that support can come in many different forms, could be emotional support, practical help, sharing points of view, and sharing information. And so, you know, because of the restrictions related to the pandemic, certainly this has been a time to consider creative ways to nurture relationships during the pandemic. And as I said, sort of thinking outside of the box, right? On the right-hand side of this slide, there's In terms of tech, all sorts of different ways listed that we can connect with others, from text, phone calls, Zoom, and so forth, right? So we've got lots of different options there. Some of the ideas that have come from individuals, and some of them have just been so innovative and creative and inspiring. So getting your game on, right? So like a virtual game night, there's lots of apps online that you can use and pretty much follow what the app animates or facilitates for you. So just this idea of gathering friends for a trivia night, or playing a round of charades, or as I mentioned, trying a free game site like there's code names and categories and so forth. Cooking up a new recipe, so virtual dinner plans. So, you know, deciding on a recipe, making sure everybody's got the ingredients, and turning your cameras on and making the recipe and enjoying that meal together. Getting back to basics, so pen pals and snail mail. So sending packages to each other, sending a small token in the mail, sending a care package to family, to friends, to grandparents, whomever that you may not necessarily be able to see. Okay. And then in terms of just laughter and humor and how helpful that can be, so you might start a text or other message thread with family and friends, really where the point is to share funny memes and videos and that kind of thing, stand-up comedy routines, funny photos. You might look at ways to have you know, deep dive discussions or intellectual connections. So forming a virtual book club that meets monthly, hosting a virtual discussion group. You know, I've heard of people getting together and doing like a COVID parenting support group, right? Or a COVID support group for people with aging parents, for example. All sorts of different things. So just creative ways to stay connected. And then meeting outside, having socially distanced hangouts, going for a walk, having a porch visit, you know, whatever the social distancing guidelines might allow you to do, right? So it's really about thinking outside of the box. You know, even things like leaving items on porches, leaving a little care package or that kind of thing on your neighbor's package can really make a difference in terms of allowing us to feel a sense of connection and community to others. And so really what we want to do is make a commitment to self-care. So we've covered a number of different ideas and options for self-care. So I would invite you to consider, you know, what's one thing that you might want to start trying. I think the idea is, you know, not too easy, not too hard, something that you can start doing now that's doable with whatever your personal, professional commitments are, with whatever your own level of energy is at this time. But I would invite you to consider what's something that you can walk away with, that you'd be willing to try in terms of self-care. You want to be mindful that, you know, consistency is key, noticing what are the results of doing self-care, and planning ahead. So sometimes we can be spontaneous in terms of self-care, but more often than not, we need to book it and to say, you know, from 3 to 3:30, I'm going for a walk, or from, you know, this time to this time, I'm going to be booking our dentist appointments, or whatever it might be that's self-care that you've decided to do. Just want to be mindful of, you know, avoiding alcohol, being aware of your caffeine intake. Both alcohol and caffeine can affect sleep and make you feel groggy and grumpy. And so you want to be making sure that you're hydrating and drinking lots of water, and building routines to get you outside during the day. So really doing what you can to try and find an opportunity for a brief outdoor walk during daylight. If you can, taking a call on the phone if you're able to for a quick walk, or walking at lunch, that kind of thing can make a big difference. Rearranging your space. So if you are working from home, trying to set up your workspace to maximize your exposure to the sunlight during the day, keeping your curtains open during the day, and positioning yourself to face natural light where possible. And just setting up your workspace so that it feels inviting and cozy for you. Right? Okay, so the practical application again, it's just thinking about, what's doable for you, giving your own commitments now, and what might be something that you can do that you feel would combat isolation fatigue and loneliness that collectively we're experiencing related to the pandemic. Okay, so just something to consider. In terms of other support services, so the Wellness Together Canada is a mental health and substance use support, which offers free counseling tools and support for all Canadians. This is in partnership with Kids Help Phone and Stepped Care Solutions, and Homewood Health is a proud lead partner in delivering a full range of free mental health counseling and support to people of all ages across the country. This is funded by Health Canada, and Wellness Together Canada is available in both English and French. It can be accessed by visiting the portal wellnesstogether.ca or calling 1-866-585-0445. And so in conclusion, just reminding yourself we really are in this we're all in this together. Certainly our realities, the challenges, the barriers that we all face related to the pandemic are unique and varied depending on individual circumstances. However, we're not alone in our experiences regarding isolation and loneliness during this time. We really do require a sense of connection and community for our survival. And self-care is a really important tool in terms of buffering the negative effects of loneliness and isolation. Consistency is key. It's really like building a muscle or learning a skill where we kind of have to work at it bit by bit by bit to be able to feel the impacts of self-care. So really, thinking about making self-care and practicing, I should say, making self-care a priority, incorporating activities to nurture your health and relationships into your regular routine, right? So it's just part of what you do every single day. In terms of some resources and information, there's a number there, and I'll put this slide back up at the end of the presentation, but a number of really excellent resources if you'd like some more information on some of these topics as well. To contact Homewood Health, so for English, 1-800-663-1142, French, 1-866-398-9505, and then online as well. If you are a customer contact and have any questions or specific needs that you'd like help addressing, please do reach out to your account representative or team, or you're welcome to call our 1-800 number and we would be happy to assist. Okay. So this brings us to the end of our webinar. I will just pause here for a moment and see if there's any questions or comments that come in. And I will also go back to the resource slide if you'd like to take down any of those resources. Okay. So I'll just, there's a number of questions that have come through, which is great. So I'm just going to go through with some of the questions and comments that have come in. Okay. So there's a comment here about writing down feelings, the feelings that you're experiencing, looking for the silver lining through this time, focusing on the positive things that have become a purpose and the hope I can look forward to better being. Thank you for that comment. Okay. Any tips for compassion fatigue for those in caregiving roles? Excellent question. And certainly for people in caregiving roles, whether it's a personal role, a professional role, or quite often both, I think one tip that I would have is, first of all, to be self-aware of if you're experiencing any compassion fatigue, how you're feeling mentally, how you're feeling physically. noticing any changes in yourself in terms of your physical or mental well-being, reaching out for support. That support might be reaching out to other peers who are also caregivers, again, personal or professional, who may understand and can support in terms of your reality, considering reaching out for professional support. And also going back to self-compassion. So sometimes when there's compassion fatigue, it's a fatigue in terms of compassion for others, but also sometimes it's a fatigue of compassion for self. And so going back to doing some work in terms of having compassion for self and how difficult this is. And I would encourage you to look at the selfcompassion.org website. There's a lot of exercises, as well as Krista Neff's book. Really useful, practical exercises. I do them myself around practicing self-compassion. Can be an excellent tool in terms of compassion fatigue. Really great question. Thank you. It's easy to, so another comment that's come in says, it's easy to say these three things, but what if I don't have the motivation? It got up and went and my mind races at night. What do I do? Yeah, good question. So, I mean, motivation, our energy has certainly, I think as a collective, has been impacted by the pandemic, by isolation, by loneliness. So timing is certainly important. I think if you are getting up at night and your mind is racing at night, I think the priority at that point is that night. And perhaps the progressive muscle relaxation, the mindful breathing, anything that you can do in that moment to try to settle yourself physically and mentally to be able to enter sleep again. It might be looking at sleep hygiene overall. And when I say sleep hygiene, I mean looking at sort of what's your sleep routine, right? So looking at the temperature of your room, looking at the setup of the room, looking at what do you do an hour or two before bed to kind of signal to your body, okay, we're going to be transitioning into sleep time, right? So looking at that sleep piece. And then in terms of motivation for the other tools, yeah, I think you want to be practicing those at a time during the day where you feel rested, you feel you have the energy, you're grounded to be able to try some of those skills or strategies. Yeah. Okay. Will this session be recorded for future viewing and can it be accessed? So I've got my colleague Jennifer on this call as well. So I'll ask Jennifer just to put the response in for that question and then I can address it. So the question is, will this session be recorded for future viewing and can it be accessed? So I'll return to that question at the end. Some thank yous. Thank you very much for those comments. Okay. Okay, so a number of positive comments. Thank you for everybody's participation and comments. Are there any other points on how we can help friends, family going through the same in addition to helping ourselves? Yeah, great question. So, you know, we're all in this together and it's, everyone is experiencing some impacts related to the pandemic. I think it's one of the ways we can help those around us is really to start by helping ourselves. So doing what we can to notice, taking our own vitals in terms of those 6 dimensions of wellness, 6 dimensions of functioning that we talked about together, really making sure that you're okay to be able to support those around you. And in terms of helping friends and family going through this, I think one of the basic but meaningful ways of supporting others is just checking in on people. How are you doing? I'm finding this hard. How are you doing? Is there anything that I can help with? And really that active listening, empathy, and asking people, you know, how are you finding this? What are you finding to be the most difficult? And trying to just understand from that person's perspective, what's their experience, what's the impact of this pandemic, what are the challenges that they're experiencing, and they may not want help, quote unquote, right? We had talked about the different types of help. So there's practical support, there's emotional support, there's information sharing. So even asking that person, you know, do you want any help and what type of help is most meaningful to you, most valuable right now? It might just be by checking in on them, trying to understand from their perspective, being sincere and trying to get a sense of what their difficulties are, that emotional support. might be really meaningful. The person might say to you, you know what, could you help me with something practical as well? But I think checking in, staying connected with people is a really fantastic way to support others. Okay. Yeah, so comment about anxiety and anxiety getting in the way of moving forward with plans. So absolutely, I think, you know, as we talked about at the beginning, collectively seeing rates of anxiety and depression increase as a collective. So if that's something that is really impacting functioning and your plans and your day-to-day, I think, you know, really considering speaking with your healthcare provider, speaking with a professional, speaking with your supports, so that you're not feeling alone and you're able to get some support in that area. Another comment came in about, I'm already feeling stressed and have to work overtime almost every weekday, then pop into taking care of family right after work. There's limited self-care time during the week. What short and simple self-care can I do daily in between busy schedule? What a great comment, right? So this double shift of working all day and then coming home, and it's kind of shift number 2 and taking care of the family. So where do you squeeze that in? And so I think it's about working with the time and the resources that you have in your work day. Is it possible to book even 5 minutes in your work schedule to book it off so that you're able to do either a mindfulness exercise, to be able to stand up and walk around, to be able to eat lunch outside, whatever it might be. And in terms of the family situation, I think taking time, and this is really difficult, I find, but practicing taking care of self, I think actually is a way to take care of the family. So saying to whoever is in your family, like, right now I'm going to be doing this and I'm not available, and I'm going to be doing this for the next 5 or 10 minutes for my own self-care. So setting boundaries at work and with family to say, you know, in order to be able to keep giving, I'm going to be setting some time apart to be able to do some self-care. Yeah, very good question. Okay. Another suggestion coming in from a participant, a friend of mine wrote me positive quotes in a journal and it helped me get through this dark time. What a great idea. Thank you. Okay, Jennifer's responded from Homewood. So regarding the question about recording, it will be recorded and posted for viewing on our website. It'll take just over a week or so for that to happen. So you will be able to view the website and or the webinar rather on our website. Okay. Okay, and then the last comment was pointing out that some of the strategies that we covered can be easily applied and practiced. So, so that's great. Okay, so I will pause here for now, and if there's no other questions, I would just like to thank each of you for taking the time during this busy and challenging time to participate in this evening's webinar. And I would encourage you to try some of the self-care strategies, and I wish you and your families to stay healthy and well during this time. Thank you.